Okay, we are recording. This is Nancy Bush. I am going to call the meeting to order, and we will say the Pledge of Allegiance. I pledge
Pledge
allegiance
allegiance
to
to the
the
to the
flag
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 of
of
the
the
United
United
States of
States of
America
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 and
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 to
to
the
to
the
the
republic
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 for
for
which
which
for
it
it
which it
stands,
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 one
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 nation,
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 under
under
God,
under
God,
God,
indivisible, with
indivisible,
indivisible,
liberty
with
with
and
liberty
liberty
justice
and
and justice
justice
for
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 all.
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 So, Doctor, I want to make sure I say your name correctly. Dayan?
Diane.
Diane. Okay.
Yep.
Like the woman's name, Diane?
Not Diane. Diane.
Diane. Okay.
Yep.
I want to make sure I'm.
It's okay. I get called everything. It's fine.
Okay. Well, when your last name is Bush, you get called almost everything as
Correct.
well. I
Correct.
was called Barbara for many years. So we welcome you. I can't tell you how thrilled we are to have you be a part of us.
Thank you.
And we are sorry we're not doing it in person, but we'll each tell you a little bit about ourselves, and you can tell us why you wanted to join this illustrious group and be our medical advisor.
Sure.
So I'm Nancy Bush. I'm a retired nurse executive. I've lived in Trumbull my whole life. My work was being the manager of hospital-based primary care centers for the underserved. I started at Norwalk Hospital. I spent additional 22 years then at St. Vincent's Medical Center, and I ended my career the last 9.5 up at Yale New Haven Hospital with maternal fetal medicine and the Women's Center. So that's me. And Deb, and I'll let Deb tell you about her. She and I joined the board at about the same time, I think, right, Deb? It was at the time when Monroe and Trumbull had been a joint health department, and then the decision was made to separate them. And God bless, we had a new director, and Dr. Kunkel, and we had like 6 Band-Aids and a desk. And what you see now is what's blossomed from then. So I'll let Deb tell you about herself, and then everybody can tell you about themselves.
Hi. I was a teacher in Monroe for many, many years, and now I am supervising student teachers from the University of Bridgeport.
How long have we been on this, Deb? 10 years-ish? I don't know.
At least, I think it's at least 10.
Okay.
Because I think I was still teaching.
And I was still at Yale, and I've been retired a little while, so yeah, probably. All righty, Karen. Would you like
Sorry,
to
I
tell
had to unmute myself there.
Yeah.
So I spent most of my nursing career in home care doing visiting nursing. And then for the last 5 years, I've been over through Bridgeport Hospital in the radiology department over on Park Avenue working. And Allison, who works next door, wrote me into being on the board here. So that's how I got here.
There you
So
go. How about
welcome.
Glenn? You two know each other already.
We know each other, but I may as well say, I don't know if Joe knows my background. I've been in Trumbull now for 35 years. I do internal medicine, endocrinology, obesity, and lifestyle medicine, so I keep myself busy. But I remember coming home one day from work, and Vicky Tesora and my wife were friendly. And I come home, and my wife said, "How would you like to be on the Trumbull Board of Health board?" And I said, "I don't really like boards." She goes, "Well, I have to call Vicky and tell her you don't want to be on it." And then I didn't have the heart to call Vicky and say I don't want to be on it. So I've been on it since then.
And you didn't know what lovely people you would meet.
Yes, I didn't have nothing. I would have just said no if Vicky asked me, but she asked Amy.
And
Amy accepted.
I had a friend of mine who that actually was called. Vicky called her to see if she wanted to do it, and she said she couldn't, but she recommended me. So I think that same sort of thing happened. And Allison.
trying to unmute here. So Allison Valance, nice to meet you. Thank you for joining us. This is my second term on the Board of Health. And like Karen said, I roped her in and I work with her over Smilo Trumbull Oncology. And pretty sure you have taken care of both of my kids at some point. We are PHA fans and patients. And so I was thrilled to hear that you were taking on this role. So very excited to have you here.
Cool.
Terrific. And then Taylor and Joan obviously are both staff, but you have met already and had conversations? Oh, okay.
Email.
You're muted. You're muted.
No, we've not met yet.
Okay.
Sue and Sam went over to PHA and met with Dr. Diane, and we haven't roped him over to our little home yet, but we will.
Yes.
So
we'll get you eventually.
Yeah. And Dr. Diane, I come from more of a global health background. After my years as a neonatal nurse at CHOP in Philadelphia, then I went overseas and did a lot of health system strengthening for many years. And I'm just excited to be part of Trumbull. I grew up in Trumbull, live in Shelton.
Wow.
And this is just the best.
Amazing.
So, yeah.
And Joan, you recently joined us
in October.
October. Right,
yeah.
Right. And we were thrilled when Joan came on board. We have been, truthfully, you will get to know me. I don't compliment, I'm a hard marker. I don't compliment people just for the sake of complimenting people, but we have been blessed with wonderful staff. Yeah. They come on board, they jumped in. We've had, Joan is our third wonderful director. Every time we thought we would never be able to match the director who left, we have another one who comes with their own wonderful gifts. So, and Taylor, runs the show. We aren't going to even go there. So we have really been blessed with wonderful staff, great relationships with them, a trust and honesty between all of us, a comfort level of being able to speak up and say, ask a question or know what are we up to. Dr. Kunkel was in your position for many, 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 many years. And we welcome you, and we know that you will make this position your own. So we thank you so much for coming on board, and you're going to find as you get to know people that we're a good group of people. It's astonishing how fortunate we've been. Yeah, so we're very fortunate. So I guess we'll just kind of move on, unless you want to tell us a little bit about you.
Sure.
Yeah, please.
Sure. So I'm Nimrod Dayan. I am currently the Chief Medical Officer at Pediatric Healthcare Associates at PHA. Okay. I started in the Trumbull office. I've been in the Trumbull office for July will be 21 years. And I will continue to be in the Trumbull office. And so many of my patients are Trumbull, Monroe, Newtown families. So it seemed very natural to sort of segue into this. So I was presented the opportunity. I said, this sounds great. I would love to do it. And here I am.
Great. Well, thank you.
Good.
Please ignore my ignorance, but is PHA, was Rick Friedman a pediatric? Okay. So, all right. Is. Now I'm in. I get it.
He's still there.
Oh, is he? Yep. Oh, God bless him. I adored him. My boys are 35 and 43. Yep. But yes, you'll have to tell him Nancy Bush still adores him. He carried us through many a difficult time, including an ear infection where he let us come and he saw my son on his kitchen table.
Right.
Which I will never forget. And I think the relationship that a family has with their pediatrician is, I don't even have a word for it. It's something
it's important.
It's important.
Yep.
So, so you can tell him I still remember him. Right. So, terrific. All righty. So we can get to public comments. Have there been any public comments that we need to address? I haven't seen anything on Facebook that worried me or concerned me. I know during the measles piece, there were some comments there that were, you know, a little bit
I'm sure.
commenty. And, but, you know, we dealt with them with grace and knowledge. I'll put it that way. All righty. The review of the minutes on January 7th. I did review them. I'll give everyone a chance to do the same. And once you've had that opportunity, I will entertain a motion to accept them. Okay, Deb, I see your lips moving, but you're on mute. So I accept your
Yes,
motion. With some
I
of
make
my
a motion.
There we go. With some,
Okay.
and I see
Allison, I'll
Allison is
second it.
perfect. And all those in favor say aye.
Aye.
Aye. Okay, so the minutes are accepted. Review of the January Health Department activity report. And by all means, Joan, do your thing. I was very interested in some of the meetings that you had in the first part of your report. If you could throw a little information at us about some of those meetings as you go through who you met with. I'd appreciate, like, for example, the counseling center. What was that piece? I see you met with the Board of Ed superintendent.
Yeah.
Was that about measles? Whatever. So if you could just include a little bit, you know, a couple of sentences about what some of those included, I'd appreciate it.
Sure. Well, the counseling center reached out before the end of the calendar year to schedule time in January for me to meet Robin, the director at the counseling
Okay.
center, just to get to know each other because we should be collaborating quite a lot.
Yes.
Turns out we went to the same tiny university in Western New York State. Go figure.
Oh, wow.
It's so tiny. And that was wonderful just for me to understand all their programming, the breadth of their programming, which I hadn't quite known.
Yeah.
So that we can look at ways to collaborate. They are eager to include our TAG members, our teen advisory group,
Yep.
with a lot of the activities they do with teens.
Terrific.
They really want to make sure that we're fitting together well. And so that was a great way to start the year. And
Terrific.
I also reached out to Dr. Semmel's office to meet with him because we didn't know what was going to happen with measles or anything else. And thought before things get really, really busy for them at the beginning of the year, meet him and get to, so we would at least be familiar with each other.
Correct.
In case something big happened. Heaven forbid it would be at the high school or even any of the public primary schools. It was not easy when it happened to a private school. And at least we didn't even talk measles that much, but just got to know each other. I got to understand a lot of his programming and approaches, and he got to understand me and the health department a little bit too.
Well, I think that's terrific that you have a relationship before there's a catastrophe, right?
Yeah.
And then you can talk to each other, you know each other, and you have some trust before you have to jump in. Terrific, terrific. Yeah. There was another one that you did the budget, which I totally get.
We still have the hearing to come
okay.
with the finance committee.
Okay. Well, that, to my understanding, on occasion can be a little bit difficult. If you need anything, including me to be there or anything, I'm happy, to be there and support you.
We're waiting for the town to finish their pieces of our budget. They do all the utilities and things like that.
Yeah.
Once it's completely done, I'll share it with you.
Okay.
And give you some of the rationale behind. We moved a couple things a little bit, but
it's gotten a little bit easier the past few years. I think that, and this is just totally my bias, but I think people really had a greater understanding of how important the health department was with all the, between COVID and all the crises that have happened over the years. But there were times, and Deb will remember this, when we had to argue about letting the staff get a T-shirt that said health department on it.
Right.
So we've come a long way, baby. Right, Deb? And So, but if there are things that you need our support, we're here.
Yeah, the biggest difference this year is that we have to pay for the community health needs assessment again. So that's making that it's every 2 years, and that's $5,000 that we pay to Yale. So it because our contracts line is modest to begin with, that additional 5,000 looks like a big jump. And so just making sure that it's clear, it is seasonal, it's every 2 years. And then we also had taken some of the vaccine line, because we're buying enough vaccines, but we're not using the full amount that was budgeted the last 2 years for an electronic health record. Yeah, we feel that we really need to become HIPAA compliant, protect PII, and to make sure that things are much more efficient for both Sam getting things uploaded to the state and for Taylor and Jen to be putting our billing through. And we think we found a wonderful program. We're going to have to use some funds from this year to do the initial package, the initial process of them getting you onboarded is a little more expensive than your annual subscription. And then the annual subscription should fit nicely in our budget, as long as finance doesn't pick it apart. But we're focusing that compliance is really the key here.
Absolutely. And then I would think billing, you would be able to have a lot less time spent on billing, correct?
The billing will be far more efficient.
Yeah. So you might actually make up some of that money with either saving staff time or more efficient billing.
Right. And we're able to eliminate the current clearinghouse that we pay for. It's a couple $1,000s. We can eliminate that to help pay for the electronic health record, because the one we want to choose. And Bill, I'm writing you a memo so you can understand what this is. So it'll make things more efficient.
Terrific.
So we're excited about that.
So we're moving into the future. Thank you. Those were the questions I had. What else would you like to tell us about for your activities for January?
Well, how about, if I can interrupt, Joan?
Yeah.
How about grant writing? Are there any grants out there that might, be able to be used to offset some of the costs?
Yeah, Deb, we're looking. It's so tight right now because of the dismantling of the whole federal system.
Yeah.
A lot of what we get from the state is actually federally funded, as a source. So there's not much there. I think the next thing to look at, always looking at the state and what they have coming in, either from the state coffers or from, and advocating at the state level would be a great idea. Or from the feds. There's still some money coming in from the federal level. And then there are some foundations that look at strengthening local health teams, and we might need to maybe partner with a couple of other health districts or health departments to go
I'm
together
thinking,
on something.
Like, I can't give you a name right off the top of my head, but like for the tag, for like the drug advocates, the
TPOD. Yeah, TPOD is writing they're currently writing a big grant right now.
Okay.
Yeah, they're in the process at the moment, and they're excited about it.
But we lost some grants, did we not?
I think we did.
Lost some grant money due to this government change.
We've just passed the anniversary of all those executive orders, that traumatic moment. So we choose to forget that time. We did 2 of those were actually in their last year. But they didn't get renewed either. Which you always kind of hope for. So that's a great point, though, Deb. Looking for grant money is always a godsend.
Yeah, but just anywhere.
And it helps us to do more creative interventions when we have grant money. So we will. Any of you, if you see anything out there, or see anything that might be worth me hunting down, very happy to do that.
I'll keep my eyes open, especially at the college level, see if there's anything they tap into.
Yeah, I'd love to.
And the other question I had, I don't mean to keep derailing you, but while it's on my mind, do we have any interns from the colleges. We used to get somebody from Sacred Heart, somebody from Southern.
Yeah, we have one person right now from, was it Oak Hill, what's the name of that college? It begins with the Oak. We have a nursing student.
Oh, not
Not sure.
familiar. Oh,
I'm only
Oak
getting
Hill?
a charter.
maybe it's an online program?
I think it's down like in Reading or Norwalk. Anyway,
Oh.
we do have one person. It's not, she actually has a project she's doing. So Sam is mentoring her. And
Okay.
she's an RN student, an adult RN, like a mature RN student.
Right.
And so she's going to be doing a Narcan training.
Okay.
Okay.
And I think then for her capstone, Sam's working on her planning some other work for that. So it's less of the younger interns that can do
Yeah.
like beef up our
Yeah.
social media or
That's
that
what I
kind of
was thinking.
helpful
That
stuff. Yeah, we
yeah.
don't have those at the moment.
All right.
Yeah,
Well,
we'll stay open to them though.
all righty.
They're always creative to have.
Yeah.
Well, now that we both interrupted you, why don't we let
I
you
know.
get back to your report?
Sorry.
Well, just a reminder that we had a little water main break that I don't know, Glenn, if it
saw.
affected you guys or
Yeah, we
not.
were closed. Yeah, I'm in the same building as Nimrod, so we're both closed today, I think.
Yep.
Really?
Oh, you
wow.
did? Oh, we thought it might have been below you.
No, it was,
Okay.
we got no water, so we had to close the whole office.
Yeah, so we got the notice like around 6 something this morning, and poor Meg Murphy had been out there since like 2:30 in the morning or something. And so we closed a couple of restaurants, two actual restaurants, because it was mostly from Constitution or Commerce down. I'm
Commerce
confusing
Park.
Shelton. Yeah, I'm confusing Shelton and
Okay.
Trumbull right now. Sorry. Over toward Trumbull, but then stopping at the tennis club. So it was really only
Pronto
Mexican-
123. Was it
yeah,
Pronto?
yeah. Pronto 123 was affected, but only for coffee because most of their food is prepared.
It's already prepared. Yeah.
Yeah,
Mex on
and
Main
the same with Alltown. It
Yeah.
was
Alltown.
Mex on Main and the sushi place, Izumi.
Yeah, that
Okay.
whole area.
Yeah, they weren't too happy that
I'm
we
sure.
closed them. And then there are a couple of buildings, like a sporting complex and Unilever have cafes in their buildings that are licensed. So we closed them as well. I think it was less traumatic for them because they don't rely on people off the street. And we looked at, because Aquarian can't test the water until they flush the lines. So then today they would send samples off, and they can't tell if there's bacteria in it until at least 24 hours, sometimes 48. And so when we looked at the regs on what it would take to allow the food establishments to stay open safely with a workaround, it wasn't worth it for a couple of days. You have to make sure they're not using like crushed ice to hold the sushi cold, because the ice would be contaminated. They can't use their automatic dishwashers. I mean, it just gets really, you'd have to spend a long time with them on what the workaround was going to be for the entire restaurant process. So that would be worth it if we ever have a huge storm that's going to take 2 or 3 weeks to recover from. Then we can go in and help them make a plan. We can get the state to help us. But for 24 hours, it wouldn't be safe to try to do all those workarounds without enough support. So unfortunately, they're closed for a couple of days.
Okay.
So
Well,
and Brightview Daycare said that they were moving their kids and their teachers over to a different building.
okay.
And I think Kumon was closed, if I'm not mistaken.
I didn't realize that it was in my mind's eye. I didn't realize it was going to impact to such a degree. So you obviously had your eye on the ball there.
Well, there you go, Joan. Another new thing.
So every time I have a Zoom with you, some crisis happened during the day.
I know.
Last time we
You're going
Zoomed,
to
it was
stop
our
wanting
measles
to meet
outbreak
with us.
day.
Measles, no water. There's always.
I think I want to meet in person from now on. They seem to be calmer.
That's right.
But anyway, that was our adventure for the day. And Rich and Nicolette were the ones who went out. They Dr. Diane, they are our sanitarians, and they're just so calming but firm. So they're polite and very even keeled, but
Well
when
experienced.
Rich tells you to close, you're going to close. So
Well,
it worked out really well.
Great. Thank you.
We finished our last 2 doses of flu vaccine.
Okay. Okay.
In January, along with like 8 other vaccinations we gave during the month, which was nice. 3 of those were MMR.
Yeah, I saw. Well, I didn't see obviously February, but I saw January. Yes, that you.
Yeah.
Yeah.
Yeah. So we were glad that at least a few people are thinking about MMR for their kids. And it looks like most of the flu is subsiding, but they're saying not at state level, but federal level, that influenza B is starting to like crop up, but it won't be as raging as our influenza A was this past year.
Yeah.
So we just ordered our flu vaccine for next season yesterday. And so Sam is going to swap out a little bit of the flu block that we ordered this past time, even though it's a lovely vaccine. People just aren't used to it, and get a little bit more high dose.
Okay.
Which is very, very popular.
Well, you've got the over 65 group, right?
We have, and who could use flu block, but they like their high dose. So we're going to order more, but we'll keep the total amount at about the same level for the next flu season. It's amazing that you have to order it, but so early.
I know.
And we'll get the entire stock in August, and we'll start marketing and encouraging people to come a little bit earlier, even though people still call and inquire. The sanitarians were still pretty busy for January. They finished off all of the cosmetology and tobacco licenses. They keep doing a lot of inspections ongoing all the time, but the ones they spend the most time with are when they have to go back and re-inspect and coach and get an establishment back on track. And still some septic permits, even at this time of year. At least they're not trying to do soil samples right now, but Rich was pretty cold. He did a few early in January before we got this big snow. And it's amazing that they're still thinking about septic. I don't know why.
Yeah. So I noticed, well, in terms of some of the inspections, I noticed that one of our restaurants in Trumbull Center is closed. And I know they were one that had been repeatedly visited.
Are you talking about Ichiro?
Yeah. Did they just?
Well, I think because the Trumbull Center, I think it was more due to their rent.
Okay. What's just going on in Trumbull Center?
It's kind of dissolving the entire.
But it wasn't us. Okay.
Yeah. No, we did not shut it down. I'll let you know if we have to shut anyone permanently.
Okay.
We only do short closings until they get something back on track.
That's what I kind of thought.
Yeah.
But that's kind of interesting that you got some people coming in from measles. Were these older children that were just starting, or maybe updates, or do we know?
I didn't ask Sam, Nancy, but that's a great question. Next time I'll ask her a little bit more about like who are these kids.
Yeah.
But they were all pediatric.
Yeah, glad to see it.
We're not doing adult MMR.
Yeah, glad to see it. Yeah.
Okay. The storm obviously distracted all of us for a few days. That was exciting. Radon awareness was great. They distributed 45 kits at the event at the library. And Taylor, I think you told me, I thought I wrote it in this sentence, but like another 7 or so were distributed even after people heard about the event, couldn't get there at the library. So they came into the health department and got their radon kits.
Good.
Yeah. And Rich and Nicolette coached everybody on how to place them and encouraging everyone to send them back into the state. We'll get the results and the household will get the results to see if they need to do any mitigation. But apparently it takes a long time, so we won't really know. We did the Know Your Numbers event on
I saw
Monday,
that. Yeah.
which it was good. It was like a steady little trickle. We didn't get a ton of people, but we did get to use some of our HbA1c point of care test kits, which was great. I think it's something that we can do even more often as we have the kits. It'd be terrific. Both
I think
Sue,
the cold has kept some people indoors. I mean,
Yeah.
I noticed that at some other activities that I've been to. It's been cold, and when it's 4 or 5 degrees, some people just aren't coming out of the house.
that's and very rational, very rational. We completely understand that. But also and then we're also planning the blood drive. So that's on the 27th at the senior center. It'll be listed again down below with what's coming up. So the planning's gone really smoothly because it's with the Red Cross. What we also want to do is make sure that we talk to the town about releasing workers to have the time to go because it takes a little while, and make sure that we're, as a town, that we're invested in helping to make these events successful in addition
Joan,
to the community.
sorry, Joan, do you know,
Yeah.
do they still have spots available for the one
They do.
at the town? Okay.
Yeah, they do.
Right.
You know,
It'll be at the senior center, not at town hall.
Okay. I do think it's important to allow employees time to do it.
Yeah.
You know, everywhere well, of course, I only worked in hospitals, but,
Where it's a given. Yeah.
you know, right. But I think, you know, giving people time off from being on duty to be able to do that is important if they can.
Yeah.
Yeah.
Yeah, totally agree. And so both Sue and Sam participated in a Region 1 emergency preparedness Arctic Blast tabletop exercise, which was very thematic given, and it was planned long before our Arctic Blast. Yeah. So that was great.
Oh, yeah.
And Sue is in the thick of, and Sam's helping her in the thick of a whole bunch of preparedness exercises that are going to be happening from next month through May, mostly March and April, but it's going to be busy. The next one is a cybersecurity tabletop exercise, you know, where everybody's going to talk through their plans, just with Stratford, Monroe, and Trumbull. And so that's health teams, emergency management teams, IT teams, everyone coming together and figuring out what we would do if. And so there's a whole scenario, and it's facilitated by the cybersecurity and cyber and infrastructure security team at Homeland Security. They have a team based here in Connecticut, and that person will come facilitate, which would be great. And then there's a two in sequence, this like Region 1 biohazard 100 tabletop exercise. It'll be an infectious disease, or, well, no, it'll be a biohazard. It could either be an infectious disease being released, or it could be another
Chemical.
it could be a chemical. Yeah, it could be anthrax even. Yeah, but I think it'll actually be it. They haven't told me what the pathogen's going to be, so we'll find out. I think that's supposed to be a secret, so that we are, because we're going to be taken through the immediate incident and on through how everybody communicates, coordinates, comes together, and what happens from there. And then that will be followed up by a fully functional exercise taking place at a middle school in Westport with our entire region. And that one will be setting up a point of distribution, which will be cool. That's always fun. Good. And then we did the budget, submitted the budget, talked to the first selectman and her team about it. We started reviewing these electronic health record systems, and Sam started mentoring her RN student. Coming up, apart from those exercises I mentioned for preparedness, we've got the blood drive coming up on the 27th. we're still doing our CPR, our hands-only CPR video challenge. If you know anyone who might like to watch a 1.5-minute video, and then answer, the only questions they answer at the end of it are, is this your first time or a repeat? And then the other
Okay.
one is, what town do you live in?
Okay.
And we are trying to get Trumbull to start beating Fairfield and Stratford. We're out of the entire state, I think we're number 5. So we're doing okay.
Is that on your face? Did you have a Facebook on it? Because I usually try to.
I think there was a link on Facebook. I'll ask Sam to
Okay.
put it up one more time
Okay.
to see if we can reignite it, because we've
Maybe
got
I
half a
missed
month
it.
to go for Heart Month.
Okay.
Yeah. And then food establishment licenses start next month. So that's the busy month for that team. So some nice activity coming up. Any questions?
As always, you're always so busy, and I'm always amazed at everything that the team accomplishes with the limited amount of time and people, and you accomplish so much. It's always amazing. So congratulations for all the successes. I know I ask this every month, and I apologize for it, but the lead cases. Do we know what those lead cases are about? Are they from, people redoing their homes in the old home and having lead, or
Oh, what
just
the
some
source
sort of,
is?
yeah,
The ones we have right now are all old. So I'll check with it. And what's nice about the lead is that it's the sanitarians and Sam like work together on the lead,
okay,
which is really cool. That it's a very holistic approach. So, and Rich keeps track of what it is. A lot of it, from what he told me when I first arrived, most of it's dust.
oh,
Well, which comes from it comes from the environment. So it's either coming from the paint in much older homes that's starting to disintegrate a bit.
yeah,
Years and years ago, it was living near highways, and with open windows, but I think that's not the case anymore.
just
I
be
think
interesting if we need to focus any education on it. That's my only thought. I don't know.
Yeah, and we have a lot of material. There are some new state guidelines on accessing funding for remediation and mitigation. So they're trying to streamline that because it's managed through the Children's Medical Center, and it can kind of get backlogged a little bit. So they're trying to streamline it and have the local health departments take more of a role in bring the local health departments in earlier at an earlier stage of doing the follow-up once they're diagnosed.
Dr. Diane, do you find that you've got children with the high lead levels that are focused on one particular cause?
Not particularly. We've got, we screen them at ages 1 and 2. And we really don't, we don't get that many that have an elevated lead level. More often than not, it's either the house. Occasionally it's kids eating dirt and stuff, but really,
yeah,
and soil.
Yeah.
And then
Thank
they do check out the spices too, because that's
really,
yeah. Yeah, they're finding more turmeric.
You know what?
Is one.
I just heard that
Yeah.
there's arsenic in what's
Cinnamon?
the candy Nerds. Is it Nerds?
Nerds has arsenic?
Arsenic, yeah. I forgot where I just heard that.
There's something in everything.
Yeah, I know. I know.
Yeah,
I think it's Nerds that I just heard it. Yeah.
My kids love Nerds. Oh, jeez.
Now, don't quote me for sure, but I'm pretty sure it was Nerds.
Okay, wow.
That's pretty wild.
Anything else then on your activity report that you would like to add, Joan? Have we stopped and started you enough?
I think that's
Yeah, sorry.
it. Now that the holiday season's over and the snow has finally given us a break, we can get into more routine stuff. So yeah.
Okay. So in terms of old business, why don't I ask the question about the June meeting, which currently is scheduled on June 10th. And look at me, I still have a paper calendar. For both Glenn and myself, June 10th is not particularly convenient. We could either cancel it or we could move it to the 17th if that works for people.
Fine for me.
Okay, then sorry, Taylor, you sent out all that info, but maybe we could change the June 10th to June 17th.
That changed.
Okay, thank you very much. We will do that. And then we will miss Glenn on April 8th, just to make sure we still have enough of us, which I think as long as just one person is missing, he's going to be in some fun place that we'll be wishing we were with him. But
Yeah.
I say do it. Everybody always says, enjoy every day and do things. But, Karen and Allison and everyone, it isn't until you face something, whether it's a health issue in your family or something that goes on, that all of a sudden you say, yeah, you know what? I really should have been enjoying every day, right?
Should have traveled more.
So, yeah, so enjoy every day. All righty. Is there any other old business that anyone, oh, poor Allison, she's picking up somebody. Is there any other old business that anyone would like to bring up? Okay.
Still wondering about the what we're doing for Dr. Kunkel.
Yes. Have we heard from him? I know we sent flowers or fruit or something, but is there anything else that we've heard?
Oh, we did. Oh, I didn't know we did.
I think we
said
did.
food.
Yeah.
Taylor, what was it? It was like a.
It was called
Something nice.
Spoonful of Comfort, and it was like a soup basket.
Yeah, that's
gift.
nice.
Yeah.
Oh, cool.
Yeah.
Okay.
And have we heard anything else from him? No.
We have not.
We could
Yeah,
probably
I think we need to find someone who
Yeah.
can approach the family and just gently let them know that people are thinking of him.
Okay.
Right.
I can send a text. I'll do that right now when we
Okay, that'd be
finish.
great.
That
Yeah,
says, we're thinking about you and miss you.
yeah.
Yeah. Yeah, because he's
Thank you, Nancy.
a
Yeah.
wonderful guy, a heck of a guy. Okay, so that's old business. Is there any new business that we need to bring up? Any thoughts, any concerns? Dr. Diane, do you have anything that you would like to bring forward, that projects you feel we should be looking at, or
I'm just getting my feet wet. So
okay,
give it time. I'm sure there'll be something.
Okay, that's perfectly fair. And does anybody else have anything that you feel we need to talk about? And Joan, is there anything else that you feel we need to talk about? Any residual measles stuff, or everything kind of worked out well in the end? And
Yeah,
I know you had there was some difficult feedback for a while.
Yeah, I mean, everything's calm in town.
Okay.
The state is just now starting to do their debriefing
Oh,
of the
okay.
entire, it actually affected many, many towns because of so many people being in doctors' offices and hospital waiting rooms and things.
Sure.
And next month, I think will be part of a debrief with the school and the state, with just a couple of us to just kind of talk through communication patterns and things like that.
Okay.
So
okay.
it'll be there'll be a little bit of discomfort during March all around. It always makes each party, both like the local and the state and everybody, feel a little bit vulnerable because nobody's perfect.
Yeah.
But we'll get through it. It's all good.
Okay. Well, if you need us, we're here. You know that.
Thank you.
All righty. So, I guess one last welcome for our new doctor. Thank you so much. We are appreciative of you being here. And yeah, please tell Rick, another thing I adored about him was when I first started. Both my boys are adopted, so they were different ages, and we didn't have a lot of information and whatnot. And he was wonderful because he said to me, "Now, I know you're a nurse, but I'm going to treat you like a mother."
Right.
And I loved it. I just thought, that was the perfect way to get started. And, I just always thought the world of your whole group, truthfully. And I know all of us feel that way. So you're so welcome. And you can tell him all those wonderful things.
I absolutely will.
I did. He probably won't. My boys are very grown, so he
You'd
probably
be surprised. He remembers everybody.
Does he?
Yes.
Well, when I was walking through Yale, I think I got lost because Yale is like miles and miles. And I was walking through a building and I saw a picture of pediatric residents, and I recognized him in one of the pictures.
That's funny.
So, yeah, I'm sure I remember walking through there and seeing that. So, at any rate, we welcome you. We always appreciate Glenn. You always are so helpful, as is everyone, and we appreciate you all. So I will, if there's nothing else to discuss, entertain a motion for adjournment.
Make a motion.
Karen and Deb, would you like to second?
I think Glenn is.
Glenn, second. And all those in favor say aye.
Hi.
Aye.
I thought I heard you, Glenn. I'm sorry if you.
There you go. Thank you, Glenn. So we will all be together in person on March 11th. And that we will see each other then and be able to shake hands and say hello. So thank you, Allison, for doing this while you're picking up children and doing your thing. Karen, thank you for doing this while you're going through your own health struggles.
Thank you, no problem.
And we appreciate everyone's input. And this is a terrific group of people, and I'm proud to be a part of it. So, and Joan, as you know, we welcome you and Taylor every day. So, and Bill, we couldn't do it without you.
Oh, thank God for Bill.
Thank God for Bill. All righty. So good night, everyone.
Good night.
Good
all.
night.
Night. Take
Night.
care.
See you in a month.